Welcome everybody. My name is Kimber and Kimber McKay, and I'm going to be spending next couple of hours with you talking about program evaluation, which is one of my main passions in life. I really know that it sounds a little geeky to say so, but I really enjoy this line of work and helping people understand the different approaches that have been used in evaluation and how it can be a really, really useful tool for us in, the world of public health practitioners, which I think we all share as part of our professional identities. So I am going to be with you for the next 4 days in different forms. Tomorrow I'll just be with you online, and Wednesday as well, because there are 2 at-home portions of this training. And today and on Thursday morning, I'll be with you using this Zoom platform. And so the agenda that Nicole just sent out and what you can see on my screen here just walks you through the different sections of the presentation today. So obviously we're in the beginning section where we're just trying to get everybody online and get the tech working for everybody. And we'll do some introductions in a few minutes. And then I'll show you what Moodle looks like. That's the learning management system or learning platform that we use over here at the University of Montana for online courses. And it's just a place that you log in. You're gonna add your credentials, and you will be able to access the information that I've posted for you. And some of the information that I've posted for you is like you might click on a PowerPoint presentation and press slideshow and play from the beginning, and you'll hear my voice and I'll walk you through a handful of slides. Or you might be clicking on a link that takes you to a video on, say, like YouTube, that platform, that will explain something that is going to be using someone else's voice, but it's the different angle on the same concept that I've already explained to you, either in my remarks this morning or in the handful of PowerPoint slides that I have for you to click on at home tomorrow. Then on Moodle, there's also a place for you to discuss with your group what you want to do for uploading your own mock evaluation. So a big part of the training this week involves you working your way through the main components of an evaluation. So putting together your own evaluation plan that pertains to some either real or proposed or hypothetical substance use oriented intervention or program that you're either doing or imagining that you'll do in the future or hoping to do in the future, and where you need to think about evaluating the efficacy of that program in your community. So when I click over to the Moodle screen, I'll walk you through how all of that looks and help you figure out how you're going to access that. And so then in my remarks to you that are pertinent to program planning today, I'll be talking about all of the different steps that go into program evaluation. I'll start with a little bit of background on program planning, because program planning and program evaluation are very much linked, and talk you through all the different parts 1 through 10. So you can see those steps 1 through 10 on the agenda here. So on Tuesday this week, tomorrow, online at your own pace, you'll be working through a collection of 3 exercises that are going to be taken straight from the stuff that I explained to you this morning, or the information that I share with you in my slides this morning. My slides are also uploaded to the Moodle site, so you can always have those open on your screen at home and refer back to them whenever you want to. And the agenda is also there. So on Wednesday of this week, again, it's an at-home day where you and your group, typically we have 2 people per group. That's assuming all 10, or I guess now 11 people join the training. And I might have to rejig those now that we have fewer people on the call this morning than I anticipated. But one way or the other, you're going to be either working with one other person or maybe 2 other people, depending. And on the second day of the at-home stuff with your group, you're going to continue the exercises that you began on Tuesday by going into the details that you can see under Wednesday, June 23rd, defining the log frame, identifying what metrics you want to use, and so forth. So I'll be talking you through all those things as we go through the material this morning. And then I will be online, popping into the Moodle regularly, available by email, etc. If you have any questions, then you can always just reach out to me by email or converse with me in the discussion section, and we'll figure out how to get your questions answered. And then on the last day, the fourth day of our training, which is Thursday morning, again, we're going to be kind of in person on the Zoom platform. And each of the 4 groups will be presenting what their thinking was behind oh, sorry, Kathleen?
Talk to some of the prevention specialists throughout the state, see what they're.
Oh, I'm not sure Kathleen was talking to me. So going back to what I was saying about Thursday, so we'll be hearing from each of the 4 groups what the evaluation plan, mock evaluation plan looked like that they came up with, what kind of feedback they received from other group members, using the workshop tool on Moodle, etc. And then at the bottom of the agenda, you can just see kind of a handy dandy reference to how a logical framework works. And like I'll explain to you in a little bit here, a logical framework is kind of the skeleton for one of the primary evaluation frameworks that is used in our field today. Okay, so that's what the agenda looks like. So I'll stop that share. And what I wanted to do is just hear a little bit from each person on the call. If you could just introduce yourself and let me know a little bit about you. And I'm just sharing. Emily, can you see my PowerPoint slides now? Okay, good. And just hear a little bit about what projects you're working on that might need evaluation, in addition to what is your name, where are you from, and where do you work now. And this will help me understand kind of how your background and what you're working on fits into what I'm going to be talking about with you across the 4 days of this training. So just to go back a little bit, can you all see that picture now, Emily?
Yes, we're seeing your presenter view though. So we're seeing the notes in the next slide and everything.
Oh, weird.
So under display settings up at the top, when you go into that, so go to present again.
Mm-hmm.
And then in the upper under display settings, I think there should be a toggle.
That better?
Yep.
Okay, good. So just by way of introduction, so I said before what my name is Kimber McKay. I guess you guys all know that now. You saw it on the agenda too, and the invite to our session. And so I just wanted to let you know that I'm I teach over here in the School of Public Health, and I've worked at the UM for 21 years now. And I started out my career working actually internationally and I still work internationally quite a bit, primarily in Nepal and East Africa in the country of Uganda. And I've been working with community members there since the mid-90s on all kinds of community development projects that might pertain to substance use or, for instance, in the community that you can see on the picture here on the first slide, they have pretty serious issues with overuse of alcohol, and but they also live almost completely off the grid. And so they have a lot of health challenges related to having, you know, a lot of upper respiratory and lower respiratory conditions because they cook on open fires. They don't have heat or plumbing. So they have a lot of waterborne disease issues and so forth. In East Africa, where I've worked also since the mid-90s, the problems are a little bit different because it's more tropical. It's not up in the Himalayas. And so they have diseases like malaria, et cetera, in their environment that the Nepalese folks in the mountains don't have to deal with, but the same sort of challenges. And those challenges are being met or attempted to be being met by the government and by non-government organizations. And both the government and the non-government organizations are increasingly under the gun in terms of getting their programs properly evaluated. And so, you know, when I started in the field in the mid-90s, there wasn't a very heavy emphasis, I would say, on evaluation. Like a lot of programs just kind of did it freestyle, and they, you know, just kind of gave off the cuff assessments of how programs were doing and if they were meeting their goals and things like that. But since that time, the standards have really shifted, have really tightened, and evaluation is now a massive focus. So this is true internationally in the global health setting, but also domestically, as you all know, I'm sure, that we have a very hard time justifying continued funding for our program or getting initial funding for our programs without a solid evaluation plan in place, and for continued funding without having solid evaluation results available to show to people. And so what I'm going to talk about with you today, in addition to this international work, I've also worked extensively here in the state with the DPHHS and different kinds of funding that have focused on a lot of different issues that challenge people living in our rural and remote communities here in Montana. And the challenges and the needs of both the population and of program planning and program evaluation are almost identical, to be honest. You know, I think we think of ourselves as a developed nation and we're very wealthy in comparison with those two countries I just talked about. But in terms of getting the work done and the personalities that come into play and some of the challenges in terms of managing your timeline, developing plans that are actually going to work and make sense to local people, and developing ways of assessing them, they're almost identical. And so that skill set transfers really well. So if you're interested like me and are passionate about evaluation, I will say it's a toolkit that travels very well. So if you want to study that more, we offer a lot of different courses on it. Evaluation in our public health training center, not just specific to substance use, but also we have degrees in that here at UM in our public health program where I teach. So I would love to hear from you guys. So I would like to know, I can see from the screen what your name is, but if you could just repeat that, say where you're from, where do you work, and what projects are you working on that you think need evaluation? So maybe we could start with the person at my top right, which is Mackenzie.
Hi, I'm Mackenzie Morgan. I'm the prevention specialist for Fergus County, Montana. So I'm over here in Lewistown. I started my role in prevention in January, like mid-January. So I just hit my 5-month mark and going into 6 months. And truthfully, I think that I have a lot of room to grow as far as evaluation goes in kind of every program and project that I've worked on and am going to continue working on. At first, it was kind of like did I do it? Yes, I did it. How many people did it reach? Okay, great. And then now it's just looking at, you know, what is the impact?
Excellent. And what programs are you working on or hoping to work on?
So overall, I'm working with the block grant. So preventing underage drinking, underage marijuana use, and then binge drinking for all ages. Currently, I've just done a lot of like information dissemination, putting out flyers to kids for prom, flyers for 4th of July.
Yeah.
Just things like that.
Got it. Okay, thank you. Next on my screen is Esther. Thanks, Mackenzie. Oh, it doesn't want to unmute you. Oh, here we go.
Sorry. So my name is Esther Lentz. I work in Madison County. And right now I'm working on a family communication class that would really be helpful with evaluation. We started it like 2 years ago and then COVID stopped, but we were able to complete one full course in it. And we had some evaluation, but it wasn't really a a really good evaluation form. And in August, we're having a new training session for it as well. So I think it would really benefit us with that.
Great. So what's the main emphasis of that program, Esther?
It's for families to come together, adults and their kids, to be able to communicate with each other, be able to talk honestly and openly about different things such as drugs and alcohol, but also other things in their life. So it'll be 2 separate classes. The adults come and they learn to talk with their kids, and the kids learn to talk to their parents in another class, but then eventually they come together so they can communicate together.
Okay, that's really good to know. Thanks. Thanks, Esther. And next on my screen is Mary.
Hi, Mary Cameron. I work in Carbon in Stillwater County, and I've been a prevention specialist for about 2 years. Currently, I'm working on a project with our local community foundation in Carbon County. And we're evaluating the density of alcohol outlets in our county, which is really high in Carbon County. And we're working on policy for the local governments. We have several incorporated cities and the county government. And creating events and opportunities that don't include alcohol, which we identified 1 in the whole county annually.
Huh?
And that's the
Gosh.
fun one. And we are a high tourist area, high event area. So it's kind of a big project, but it's definitely worthwhile.
Yeah. Esther, can you remind me what county you're in? Or does anybody, Nicole, maybe, oh, Esther's here.
Madison County?
Oh, you're in Madison, yeah. And Mackenzie, I forgot to write down what you said.
Okay, it's Fergus County.
Okay. Nicole sent me this information before, but I didn't commit it to memory. Thanks, Nicole. Okay, next on my screen is Lindsay.
Good morning. I am Lindsay Sador from Dawson County. I work with the PFS grant. I have been with Eastern Montana Community Mental Health since February. I think that there are like many aspects that the evaluation process would benefit my program and those of us in Dawson County, just to see who we're reaching, who we're not reaching, what we can do as far as drug and alcohol prevention.
Yeah. Okay, great. I need to learn more about the PFS grant, but I'll come back to that, Lindsay. Thank you. Barb is next on my screen.
Hey, I'm going to unmute and yeah, there you go. Hi, I'm Barb Ryder,
Hey, Barb.
and I am from Jefferson County, and I'm with the Block Grant. And I've been involved in prevention for quite a while, and evaluation's always been a challenge, an opportunity, I think, to really assess how things are going and whether what I'm doing is working. So I appreciate that. I just listed several projects, and I'm not wedded to any one of them necessarily, but we had an active parenting now classes that we did here in Boulder, and then it spilled over to Whitehall in the county. And we did some evaluation, just informal, with the individuals who took the class and how was it for you, so on. That is something that we'd like to evaluate better, more efficiently, and get more information from them. And we're going to continue that class through the adult education programs through the 2 high schools, and probably do it in person and Zoom. The Zoom was really a big help to increase the participation. So that's one area. The other is I'm working with the health department with their CHIP process, which does have an evaluation process, but I just, our focus is a lot on mental health right now. And I
Mhm.
think that's a good one in relationship to what we've gone through with COVID.
Yeah.
And so that's another one. And then Esther and I have worked on a project called the Escape Room. And it's one that we're going to probably implement this summer with some of the events that are going on in Jefferson County. And it's youth focused. Basically, this one is right now, not adults so much as youth. And trying to get a message across of making healthy choices and what the effects are of drugs and alcohol. And I don't know if you know what escape room is, but they give clues. And
Yeah.
anyway, so it's a fun activity. At the same time, we want to make sure it's getting across the messages that we want to get across to them. So
Neat. Yeah. I've heard of people are using virtual escape rooms now. So is that how you're doing it, or are you doing it like
We're-
all in person?
we're doing it in person. We've
Oh,
got
cool.
all the stuff together. We're going to have tents, and we've got it all organized to do it in person, which I think is going to be exciting. We
That's
haven't
awesome.
done it yet. So
I love that.
Yeah.
I can't wait to hear how that goes. Thanks, Barb. Next on my screen here is Shannon. Hey, Shannon.
Hello, my name is Shannon Pitch, and I live here in Hardin. I'm the Bighorn County Prevention Specialist under the PFS grant. I haven't really done any work and evaluation yet, so I'm just here to learn all I can about it. I understand the importance of it. And currently I work with my coalition, my Best Beginnings Coalition, and we have a early learning center we have 2 local daycares providers here in Hardin, and they bring their kids over and we have stations set up. And so our goal with that is in September, because things are just now kind of starting to get back to normal, is to open it up to like a parents and recovery center. And so we're just kind of getting the kinks out with the kids and how, so by the time we get to their parents, we can get it going smoothly.
Uh-huh. That's amazing. Okay, thanks, Shannon. Next on my screen is Sean. Maybe Sean stepped away, so we'll go next to Kathleen.
I'm Kathleen Sheffield. I'm from Libby, that's in Lincoln County. I work the PFS grant at Western Montana Mental Health. I'm not really sure what projects that I'm working on, but we are doing communities that care. And so I would like to incorporate some of those evaluations as we move forward to doing the resource portion of it, make sure that we're meeting fidelity and people are following along.
Great. Okay, thanks, Kathleen. So Sean, are you available now, or?
Yes, I am.
Hi there.
Hi. Sorry, I just actually couldn't find the unmute button there for a second. So
I feel ya.
yeah. All right. So I work out of Richland County. My name is Sean Dodds. I've been working off the block grant now since October.
Yeah.
We've had some fun events so far, but I think my favorite so far, well, I have 2. The first one was meeting with a couple high school classes and just having a conversation with them about prevention and what the PNA talks about, and different items like that. What are their thoughts about alternate activities or rewards, for pro-social activities, to get their ideas instead of me kind of forcing that on them,
Yeah.
I'm not really good at knowing what teens want. So what's coming up is we have the fair coming up. And so I'm just trying to work on being able to distribute information there about binge drinking and also about Parenting Montana.
Yeah.
And then we also have a movie night that I'm working directly with the Boys and Girls Club with. And we're going to try and do 1 or 2 movies, hopefully one during local swim meet in July. So yeah, that's kind of what we're doing and looking for. A lot of the stuff that I've done up until now has been in conjunction with our local drug-free communities coalition. So they've been doing a lot of the evaluation, but I'm looking forward to doing a couple on my own, just so I can learn. And so I'm looking forward to this class a lot. So
Cool. And does everybody on this call, do you guys all work full-time as prevention specialists?
I do.
Some people do, yeah. Kathleen, it looks like you're saying you do, or Shannon, you're saying no, you do other things.
Part-time.
Okay.
I'm part-time. I do 20 hours a week. This is Barb.
Hey, Barb. Okay, good to know. And everybody knows Nicole, right? Nicole needs no introduction. Okay. Nicole, do you want to say anything, or are you good?
No, I can actually say something about what projects am I working on, because I mean, I provide TA to the Eastern region, but as TAs, we also have projects that we work on that need evaluation as well. Like, well, a lot of the trainings that we do, all the trainings that we do.
Sure,
So,
yeah.
I was gonna just participate in this like everybody else.
That's great. Okay.
Project that I'm working on that might need evaluation. Our WITS program. I know those are bad, dirty words to all of you prevention specialists, but WITS is our online database that we enter in our hours and our reporting system that the state gathers their information for their federal grant reporting.
Okay.
And, it's a bear of a.
Okay. People don't like it.
No one likes it.
Yeah.
I have a love-hate relationship with it, but it's a necessary evil and we have to do it. And there's ways to make it better. We are working on those, but it is a process.
Yeah.
So.
Yeah, we've got a lot of those here at UM.
Sure.
Yeah. And Nicole, what county are you in again?
I cover the Eastern region, which the grants that I cover are in Phillips Valley, Roosevelt, Richland, Dawson, Custer, Fallon, Rosebud.
Okay. And you have a counterpart in the western part of the state?
I have 6 counterparts.
Oh, is that right?
So
Oh.
there's one in the Northwest region, 2 in the Southwest, 1 in the South Central, 1 in the North Central, and 1 that covers the tribal.
Got it.
Prevention specialists.
Speaking of those regions, when you guys look into the Moodle site, what you'll see is that I have assigned you each to a group, and you are going to work with your group member on the different tasks. And I did those assignments based on the regions that Nicole shared with me. Now, some of you working in the same region together are working on projects together, and some of you aren't. So sometimes that makes perfect sense, I think, because you're already working with the person in your group. And then sometimes you're going to be paired up with somebody that you're not already working with, but that's okay. Let me share my screen over here that shows you the Moodle stuff. So can you guys see now a screen that shows University of Montana? Okay, Emily says yes. Okay, so where you want to go here is, so this is the landing page for UM Online. This is linked in the chat that I shared. This link is the one that I shared previously, so you can click on that. And it takes you to all the different things that UM Online offers. And one of the things is this learning management system called Moodle. So you're going to click on Moodle non-net ID login because assuming none of you are UM students, so the net ID is just for UM affiliated people. And when you click on that, it will give you the opportunity to log in. And this one is telling us I'm already logged in as Kimber McKay, so I'm not going to log out because I need to show you some things. But at the end of the session today, I'll share with you the login credentials that you're going to need to use when you come to the next screen. So when you come to that next screen, you're going to be brought to your Moodle courses, which for I think all of you will only show one course, and it is called the SUD evaluation. So this is for substance use and And this is the set of exercises that I've designed specifically for this class. So you'll be able to see exactly what I'm showing you on the screen here. And you can click on the first part, which is welcome to our at-home exercises. It says here, this set of exercises will walk you through composing the basic pieces of a monitoring and evaluation framework based on one of the most popular frameworks out there, the logical framework. It should say logical, not logic, aka log frame. Then you can click on this PDF down here. That's the training agenda if you want to refresh your memory, or you can click on this one over here, which are the presentation slides. So if you want to click through the slides that I'm going to share with you this morning and just refresh your memory about anything there that you're interested in. Then you can click on day 1 at home or day 2 at home. Day 2 at home has this yellow font underneath it, not published to students. That just means I haven't opened it yet, but I will open it in time for you to work on it. So looking at day 1 at home, you're going to be working here on day 1 at home on your problem. So what is a problem that your program or intervention is designed to address? What is the intervention itself? What is the theory of change employed? And who are the stakeholders? So if you click on that link, it takes you over to this module. So basically this Moodle course has 2 modules, one for day 1 and one for day 2. And under day 1's module, it gives you the opportunity to click on this link right here. This is from the UN's Office on Drugs and Crime. And it is a really, really great reference document. Very simple, not very long, super straightforward on evaluating substance use programs. And so you just click on that blue font bit and it will take you over to this link on the internet. And I think you'll find it really useful. This one over here, the next one, is a quick video from YouTube, and it's a gal who I think is very straightforward, and she gives a nice and succinct reminder of what is a theory of change. And I'll talk to you in my remarks this morning about what a theory of change is, but this will tell you from another person's perspective. Then the next thing over is examples from slides, and I'll open that. It will open a PowerPoint presentation, which is taking its time. Is that opening on your screen? Can you guys see that? I think it wants me to share a different screen. So here we go. Now, can you see a very glaringly green? This is the PowerPoint thing that, that I've designed. It's narrated by yours truly. And so you just click on slideshow at the top, click on slideshow and from the beginning, and it will walk you through these 4 slides. And the last one is just a template for you to fill in. So you can cut and paste from, I left this, you can save a PowerPoint as a PDF, but then nobody can use it. So that's not very useful. I saved this one as a PowerPoint, so you can open it at home and you can take out this little table right here, and then you can populate it yourself with all of the bits and pieces that make sense to the evaluation, the mock evaluation that you're going to be describing. Okay, so I'm going to stop that share and pop us back over into the Moodle site. Can you guys see the Moodle site again? Then if you scroll down, you can see that there are 4 what are called advanced forums. And this is where the discussion is going to occur between you and your group members. So the only people that, when you click on this, the only people that are going to be able to participate are the 2 people that are assigned to the Eastern region. And the next one down is Northwest, South Central, and then Southwest is the 4th one. So those are the 4 groups. So this discussion place is a place for you and your other group member to come together, and you can just discuss back and forth here. And you don't have to use the discussion if you don't want to. You can exchange phone numbers and you can work your way through your tasks. That's totally up to you. But the discussion, I'll be popping in and out of these discussions during the day, Tuesday, Wednesday. So if there are like questions that come up, or if you guys want to ping me on this and say, look at what we're talking about in the discussion, we need help, we're stuck or whatever. This is a really handy way of kind of tracking what it is you guys have been talking about so far. But versus if you're doing it on the phone, then you might have to repeat everything. So you can use a discussion forum if you want to, but if you don't, I totally understand. And this is the workshop down here at the bottom. And the workshop is just the place where you're going to be uploading your documents. So for the first day of your at-home work, you're going to define the problem that your program or intervention is supposedly addressing, and what is the chosen intervention. So maybe the intervention is Prime for Life, maybe it's Parenting Montana, maybe it's Communities That Care, whatever. It might be an existing program that you're implementing that's got an evidence base from some other community. Then what is the theory of change in that particular intervention? Now, if you're not designing the intervention yourself and you're using somebody else's evidence-based program, you should be able to find their theory of change somewhere stated already. So you can just cut and paste that here. Or maybe you're modifying a program for your community and you need to tweak the theory of change a little bit and make it fit for the people that you're supposedly helping. So when you state the theory of change, it may look like, lock, stock, and barrel, exactly what's on the Prime for Life website. You put it in there. That's totally fine. You don't need to modify it at all. But if it doesn't make sense in your community to say it just like they did on their template, then you can modify it. And then the third part of this exercise is, who are the key stakeholders? And then I'm going to get you to think about those stakeholders. Like, what is the differing agenda per stakeholder? What can you expect from them? What might their roles and obligations be and responsibilities, and so forth. So I'll be talking about each of these things in turn as we go through this morning's slides. Okay, so that's day one at home. And then day two at home has different parts. Obviously, this is the second part of your work at home. Here, you're going to be getting into the logic model. You will construct a 4x4 matrix, talk about what your outcomes are supposed to be and what metrics you're going to use or you're proposing to use in your evaluation to see if those outcomes were reached. Then you're going to talk about how you're going to reach conclusions. Like, are you going to reach your conclusions based on, qualitative conversations that you have with people, and that's the information that you're going to use to reach your conclusions? Or what is your plan about how you're going to get to the conclusions that you hope your evaluation is going to lead you to? And then last, what's your dissemination plan? What are you going to do with this evaluation? Is it just for the stakeholders that you identified the previous day? Or is it for your funder? Is it for your clients? Who is it for? Because when we do evaluations, of course, we want to have always in mind the fact that we want to honor and respect the people who are supposedly having their lives improved by this program, right? So, I mean, a very honoring and respectful thing to do is to say to them, look, we did this program, we used up a whole bunch of your time, or you participated in, the ways that you did. Well, look what our program accomplished in the community. And so, thinking about your dissemination plan always, for me, goes back to a sense of humility and respect for the people that we're working for, who is ultimately our clients. So that's what you're gonna be working on day two. Again, there are some other bits and pieces here that will help you work through. This link right here goes to a site online, which is another document I find extremely helpful. It's very, very straightforward. And it is simply a a description of different kinds of study designs for program evaluation. And so that will help you understand like the difference between a descriptive study or a descriptive evaluation, an experimental or quasi-experimental evaluation, and so forth. And there are only 3 types of evaluations covered in that document. And those are the main 3 types that we typically see in our line of work. So I think you'll find that really straightforward and not too overwhelming. And then this video right here is, it's a young man who's describing from his perspective at his company, because companies use evaluation too in the for-profit sector, the difference between outputs and outcomes. And most people who are new to evaluation confuse outputs and outcomes. And I could even hear that a little bit in the descriptions that you guys were giving me before of some of the evaluation work that you've done so far. And so I think this will help you in addition to the things I talked about with you this morning. Then below that are, again, the discussion groups by region, where you and your group member are going to come together and discuss, like, you know, what do you want your 4x4 matrix to look like, and how are you going to choose, or what metrics you're going to choose, and how you're going to do your dissemination, et cetera. And then at the bottom is the workshop. And so that's where you're going to upload your documents. And those documents usually are just going to, it's just going to be like a Word file. So I'm going to provide some templates for you that make it really easy so that you can just fill in document and you're not like winging it and starting with a blank piece of paper, which I don't know how your brain operates, but when I see a blank piece of paper, I tend to feel like I need to go clean the bathroom. Do you know what I'm saying? So, but if it's like started for me, then it can really help get me going. Okay, so that's the Moodle site. So the most important thing for us to work on today, after we finish our, our time slot 10 to 12 this morning, is to make sure that everybody logs in okay and doesn't have any problems with the login. So I will be giving you the login information, which I just realized after I started talking this morning that I only know how to log in myself with my net ID, and I don't know how you guys are going to log in because you're not members of the UM community. So I just need to get that information from the UM Online people, or maybe Emily can work on that with Shay while I'm talking, and then we can get that out to everybody participating. So we'll make sure to get that to you. And then you can start working your way through the exercises tomorrow at your leisure. So I tried to make it like a manageable amount of information that you would take in each day using those short video links that are like, I'm serious, they're 5 minutes or less, or the documents. I picked ones that are very straightforward, really user-friendly, etc. And then a manageable amount of information that I want you to generate and give to me and to your other group member or other class members, because the cool thing about these the workshop functionality in Moodle is that it allows you to see each other's work. And so the final step, besides uploading your information, is going to be look at one of the other groups and see how they did and give them some feedback and using the assessment tool. So once you click on that workshop where you add the information, how you go through the steps will be obvious. So it will walk you through, like, here's where you upload your stuff. Okay, next phase is assessment. And you're going to look at somebody else's upload and give them some feedback. And then we'll all work on that together in person on Thursday. Okay, so now I'm going to share my slides again and walk you through this evaluation approach that we're using here. Okay, so I think I need to do this. How's that look, Emily? Do you like the way that looks? Okay, so intros. Okay, so a lot of people that I talk to when I do these trainings don't have any background in public health. So I always like to remind people, what is public health? Because half the time I'm even talking to public health, like the public health officers, they've worked their whole career at the bedside and they don't really know what public health is, or folks who are prevention specialists don't really know like what public health, like what do other people think public health is, where do I fit in? And so just as a brief reminder, there are 5 areas in public health and they're listed here on the screen. You got your behavioral science and health education at the top, biostats, of course, how we track stuff, environmental health, epidemiology, and then health services administration. So those are the 5 areas that we teach in our school public health, and which everybody with a degree or in a master's degree in public health, or even a bachelor's degree. We have a new bachelor's degree in public health over here at UM too. Those are the 5 areas they get trained in. And so public health in our country has gone through a bunch of phases. And so we're in what's called public health 3.0 now. We were in public health 2.0 not too long ago. But public health 3.0 really came into being around the same time as the Affordable Care Act. And the real difference between it and its predecessors is an emphasis on the social determinants of health. So it's a much more holistic way of thinking about public health, and really tries to integrate all of the things that are in a person's social and economic community and world that affect their health outcomes. And so you all know that as prevention specialists, you couldn't possibly succeed in your role if you took too narrow of a focus and you somehow managed to omit thinking about how a family's economic situation or their prospects, a young person's economic prospects, or what they see in their parents for their economic situation. You cannot possibly neglect that and have an informed conversation with somebody about why they have slipped into overuse of substances, et cetera. So when we combine that with the rurality of our state, I work on a big grant, which is called the MOMS grant between Billings Clinic and DPHHS. We have counterparts across the nation. We're all working on rural health. But when people who live in Ohio or Iowa talk about rural, let me tell you, they're not talking about what we talk about when we're talking about rural in Montana. They're talking about, like, they might have to drive 40 minutes to the clinic, and they're like, oh my gosh, I can't believe our people have to drive 40 minutes. And I'm thinking, ours drive 5 hours plus sometimes. So I don't think we're talking about the same thing. So when we talk about specific issues in rural contexts, we have a disproportionately heavy burden of this here in our state. Because in our state, in addition to rurality, we also have some cultural and, we have some differences between communities with different cultural histories and things like that. Thinking about, groups that are like largely neglected by the modern economy or have chosen to step out of it, like Hutterite people, for instance, or, what is the situation for a lot of tribal populations, et cetera. We have a disproportionately heavy burden of the combination of rurality and these other social determinants. So these are, not unfamiliar to you guys, but I like to just give these when I set the scene for talking about evaluation, because one of the things that I think people who are new to evaluation don't realize is that this kind of information that you see on the screen here belongs in an evaluation. It is totally legitimate to talk through how all of these factors, or some of these factors, or a selection of these factors are specific to the program or the community that you're working on. So feel confident and like you're on solid ground if you're referring back to this in the beginning of your evaluation document, where you're describing the circumstances, what the need was, and why the intervention was chosen. So when we talk about planning and evaluation in public health, we usually pair those together. And the reason for that, this class isn't about program planning, but it's really difficult to teach evaluation or talk about evaluation if you don't also talk about planning, because the two are inextricably linked. So plans are extremely important for all public health interventions, and they accomplish these things. So they help us focus on the priorities are, they link the activities to the strategic plan or the overarching theory of change. They formalize your efforts. They set timelines and so forth, and they define people's roles and responsibilities. And then the evaluation comes in at the end in terms of measuring impact, which measurement of impact helps validate a program and provide its evidence base. So when we talk about evaluation, we always situate it in program planning because the two go together. They're hand in hand. Together, they are understood to provide continuity through change. You have your plan on the one side and then your evaluation on the other, and the two of them work together to give that sense of continuity in your office and the people that you work with as they work together over time. So one of the things that that we see is that in our state, we're not reinventing the wheel. We're using evidence-based programs that have either been demonstrated elsewhere to be efficacious, to have the parts that help you reach the goals. But what might be novel about what you're doing and the reason that you need to do an evaluation is that what works in a rural place, and like I was saying before, Iowa or Ohio might not work in a rural place here. So sometimes we are, yes, using a program with an evidence base. In other words, it has already identified like key areas of need and interest based on available data from interventions that were done somewhere else where, this was trialed. Or, we're using an existing evidence-based program because it's done other things that are important, like it already has identified what policies or environmental supports or health benefit designs, et cetera, need to be in place in order for it to work. It already shows from previous evaluations that it supports the outcomes. And the other reason for using evidence-based programs is they've been shown to align resources and infrastructure. So they already show you like you need this amount of resources or this specific kind of resources, and you have to have also this infrastructure in place. And if you have those two things together, then you can accomplish what you intended to. So using an evidence-based program is a useful shortcut, in other words, and it's also a lot easier to get funding if you're putting into place a program that already has an evidence base behind it. So how do you begin? There are 4 questions that I want you to think about and that you're going to have to answer in your work tomorrow in order to figure out what your evaluation is about in the first place. And what your evaluation is about in the first place has everything to do with what the program plan was in the first place. So the first thing that has to be addressed is who is being targeted, and it needs to be specific. If you're too general, you introduce measurement problems because you don't know who you're supposed to be gathering information from. Second piece, what do you want people to do? What do you want them to change about their behavior? What do you want them to do more of? What do you want them to do less of? What have you? Again, you have to be precise. The third piece is how much you want that behavior to change. From this percent to that percent, or from you want 10 people, you want to go from 10 people in the community doing this to 20 people in the community doing this, or you want to say at least 30 people. You're going to go from 0 to at least 30 people, or you want no more than 10% doing a certain thing. So precision in terms of the program plan, and then as an evaluator looking back on what the program's plan was, if this level of precision is lacking, then you already know as an evaluator that you've got your work cut out because it's very hard to backfill or back address a problem like that when the program planners didn't start out with some precision. So what I understand from what you shared with me before is that there are some of you who are working already on existing programs that may have already decided some of these things, but there are some of you who are thinking about implementing a program that you haven't done yet in your community. And so for those of you in the second position, you're going to need to really work these questions through and think about you know, how am I going to be precise in terms of figuring out how I want to move the dial or move the needle on a particular metric. And then the fourth question is when you want to see the behavior change. So this is about the timeline. It should be really specific and bounded, but also reasonable. So you don't want to overpromise. Like if you're in the program planning stage, or if you're evaluating a program plan, you want to see, was the program planner realistic about how much they were going to get done in a particular time frame, or how much behavior was going to change in a particular time frame, what have you. So for instance, like if you took, say, an obesity related program and you picked a metric that was like, you know, you wanted to move the needle on how many people had a BMI of whatever to a BMI of something else, and you put a timeline on it that was too short, then the program is doomed to fail if that's the metric that you're going to be using to evaluate it, because you can't change a BMI that fast, and so forth. So that's kind of a coarse example, but you can see that as an evaluator or a program planner, you definitely want to be very careful about picking a timeline that's not going to make your funder go, this person must be very green, because they obviously don't have a clue how fast you can change behavior, or how slow behavior is to change. Or if you're coming in and doing an evaluation after the fact, you can see, well, you know, they didn't hit that target, but the reason is that they probably, you know, overestimated how much they were going to be able to do given the timeline they set for themselves. So picking an appropriate timeline is very important. So these are the 4 right questions to begin. So if you were to look at this objective, it states our objective is to increase participation in the health assessment. What do you guys think are some of the problems with this statement of an objective? Anybody want to take a swing at it?
It's too general.
Yep, Sean's right. It's very general. What else? Barb, you look like you're getting ready to say something, but you were muted. Oh, Barb, you're still on mute.
Thank you. Participation in the health assessment. Who are you wanting to participate? What's the age group, or what's the yeah.
Yeah, very good.
If there's a certain age group. Yeah.
Yes, as to the generality that Sean mentioned.
Mhm.
Anything else jump out at you guys?
What's the increase?
Yeah,
No,
exactly.
anyway, sorry.
Yeah, increase from what, etc. So it looks good on the face of it, and it might be something that you just sort of casually say, but it's not going to get you anywhere in terms of program planning or evaluation. So yeah, there are questions about who, questions about what, how much, by when, etc. What would be better is if you said something like, residents of X neighborhood are going to increase their participation from 30% of households to 50% of households taking part in the assessment, and we're going to complete this by a particular date. And so that kind of precision is what I'm talking about. And it really helps define what you're doing as a program planner or implementer, and also as an evaluator. So one of the main things that we do as evaluators is work with program planners on encouraging them to think through these questions. The other thing is that we want to engage in action planning. So this is detailed planning for activities that support program objectives. And some of the things that we want to have planned out are things like roles and responsibilities, each activity's timeline, what resources are needed, both financial and non-financial, communication strategies, and then the data sources and evaluation strategies. So for models used in evaluation, there are a lot of models out there. And I've talked about logical framework so far, and that's the one we're going to use. But there are some other ones that you might have heard of. One of them is used by RAND. It's called Getting to Outcomes. And you can see it just follows this steps 1 through 10 of different things that are considered over time, starting with needs and resource assessment and walking through best practice, fit, capacities, plan, blah, blah, blah. And then at the beginning or in the middle, it shows you steps 1 through 6 are planning steps. Then it's the delivering the program steps. And then it's step 7 through 10 is evaluating and improving. And these arrows that go back just show that this is an iterative process. In other words, evaluation should occur like midstream. You know, say you have a 5-year project, there should be evaluations done in years 1, 2, 3, 4, 5. This is a summative project, but midstream or formative evaluations along the way are, no matter what evaluation framework you're using, are essential because they allow you to tweak the program as you go because circumstances around it inevitably are going to change. Pre-seed and proceed models are another kind of framework that's out there. And these are models that use some of the same terminology as log frame or logical framework. They kind of package the same information, slightly different clothing, with slightly different emphases. But I just wanted to just at least expose you to them so that you know logical framework, which we're going to focus on in here, isn't the only one out there. So pre-seed and proceed models, you guys can click through the slides later at your leisure if you want to see what all the bits and bobs are here. But pre-seed has these kind of large, like macro level levels of looking at things like social assessment, epidemiological assessment, ecological assessment, and it separates those out from implementation. It's sort of, you know, quite at the end of the day, it's kind of emperor's new clothes. It's the same stuff as what we do in log frame. It's just packaged a little bit differently. I think there are only so many ways you can do a lot of an evaluation well. And so all these frameworks tend to have the same parts, but, you know, people make their careers out of designing a new evaluation framework. And so they have to like come up with new ways of saying basically the same thing. So I don't want you to be too intimidated by all the different frameworks out there, because in my experience, they really do accomplish basically the same goals. Some of them have a different emphasis, which I think people can make a big deal out of. Like, you know, some people would, you know, maybe say, well, logical framework, it doesn't have enough emphasis on the social environment or the ecological environment that people live in, their social ecology, whatever. Yeah, I guess you could say that, but I think that logical framework used properly can include those things. So it's really all a matter of emphasis, but it's good to know that these other models are out there. What we're going to be talking about, as you now know, is logical framework. And this was developed in 1969 for the US Agency for International Development. So it was originally designed for the global development world, which was almost brand new in the 1960s. USAID rolled it out in 70, 71, and 30 different countries where they were doing overseas development work. And it was really the first emphasis by our government on making sure that our tax dollars that were being spent on improving, hopefully, people's lives elsewhere were being used, those tax dollars were being used wisely. So that's where log frame came from. Now it's very, very widely used. USAID still uses it. CDC uses it for all domestic programming virtually. You will sometimes see in HRSA or other funding, US federal funding agencies, like a slightly different emphasis, like rapid quality cycle improvement or some of the other ways of doing evaluation. But like I said before, like the pre-seed, proceed, and the getting to outcomes, it's all the same information, just deployed a little bit differently or packaged a little bit differently. But if you go to any health ministry or any overseas development agency of any organization or state government virtually in the world, you will encounter people who know log frame inside and out. It's very popular and used everywhere. The central piece of it, which I've referred to already, is the matrix. It's a 4x4 project table that really crystallizes the whole evaluation scheme and the project and the program in one simple place. And so that's why you guys are going to be working up your own 4x4 matrix on Wednesday. Logical framework also puts an emphasis on assumptions and wants us to always think through, like, what assumptions are you making when you design this program? So for instance, a common assumption is that funding is going to continue to flow to the local health office, or funding is going to continue to flow into the counterparts that you are planning to work with, that they're not all going to lose their jobs because their funding dried up. Like, that's a really common assumption. Some assumptions, and those are good assumptions, typically. The people who work for the public school system, generally speaking, are going to, you know, those positions are going to be staffed from one year to the next. There will be a school nurse, for instance. That's usually a pretty good assumption. Some assumptions are bad, and some of them are so bad that they're referred to as killer assumptions. And those are assumptions that are, if they're invalid, then they'll just kill the program. And so sometimes in evaluation work, what we're doing is we're looking through, did the program planners have a plausible set of assumptions when they designed this thing? And if the program didn't meet its goals, did it not meet its goals because there was a killer assumption that wasn't recognized? So one of the things that logical framework asks us to do, both in program planning and evaluation, is think through these assumptions and make sure that there aren't any killer assumptions that could be avoided. So the features of logical framework approach include the stakeholder involvement, which I already referred to as one of the things you'll work on tomorrow. It's a needs-based approach. It's very logical. It's based on a series of if-then statements. It gives us a framework that assesses relevance, feasibility, and sustainability. And relevance, feasibility, and sustainability are they're like the three main kind of hallmarks of good programming, whether we're talking about health programming or community development or substance use oriented programming. It doesn't matter. Across the world, these are the three sort of domains that are always covered in an evaluation. So logical framework covers those. Logical framework is not activity driven. It tends to really push us to be more results oriented. And so that's sometimes also referred to as impact oriented. And it gets back to the differences between outputs and outcomes, which I'm going to get into a little bit later. It logically sets the program's objectives, and it describes their causal relationships. In other words, helps us understand that the program was designed like it was because it was assumed that doing X caused change Y. And so the framework makes us scrutinize those causal relationships and be sure that they're reasonably linked. It also pushes us to choose indicators, which are also sometimes called measures or metrics. And that's for M&E, or monitoring and evaluation. And it describes the external factors that influence the project's success. And those are the assumptions. And sometimes those are referred to as risks. Okay, so the main output, or that critical central piece of the LFA, is the logical framework matrix, also known as the log frame matrix. And that arranges the objectives, outputs, and activities on a matrix in a systematic and logical way. It's got 16 cells in 4 columns and 4 rows. And it looks like this. So across the top row, I showed you this before, you have a narrative summary that walks you through the goal. This is, we actually want to read this from bottom to top. So the inputs lead to outputs. The outputs lead to the outcomes, which is also sometimes thought of as the impact. And the goal is that overarching, like the highest level way of stating what it is that you're trying to move the dial on. The second column is what are the indicators or measures or metrics that you're going to use to assess, each one of these rows. The third column is what are the means of verification? In other words, how are you going to verify, or where are you going to get that information that you need to populate those metrics? And then last is your assumptions. So like I said before, the log frame is based on a series of if-then statements, and it just works right up through this chart from left to right and back to left again. So if these inputs are in place and these assumptions are met, then these outputs will result. So again, if these outputs are realized and these critical assumptions are met, then it will lead to these outcomes. And so you can just use that flow of if and then statements to populate your matrix in a way that will be convincing to your classmates in this class and ultimately to a prospective funder. Okay, so working through the 10 steps then. So step 1 involves defining the problem. And there are 7 essential requirements for defining a public health challenge, and those are listed here. And so when you're thinking about the problem that your program wants to address or your intervention wants to address, you should spend some time thinking about each one of these things. Like, what's the age and sex structure of your population? So, say you're working in schools and you have this many boys and this many girls, and they're between the ages of whatever and whatever. And next, you would have morbidity or disease and mortality stats. If your program isn't disease specific, then you can shift this language a little bit and just say like prevalence of, alcohol overuse is X% in this population, or is unknown, so it needs to be defined. Then you can see all the other bits and pieces here that are critical in defining what the public health challenge is. So that's the first thing that you're going to be working on your exercises tomorrow, is just like describing what's the need that you're trying to address in your real or hypothetical program. You want to have some additional considerations here, maybe like constraints. Maybe there are existing solutions already that have been tried that didn't work or are sort of working. What setbacks might you encounter? So I worked up an example for this for pertaining to COVID-19 testing, because we've all just been through this COVID-19 thing, and it helps us kind of crystallize the ideas. So here on this slide, you can see what some of the considerations were. The problem was getting COVID-19 testing established. And you can see here for the different considerations, like, I don't know, the utility of the intervention and prevention, economic feasibility, durability, et cetera. It shows what metric might be appropriate to address each of those considerations. So for instance, the cost of tests or paying people for their labor to run those tests, collect the sample and what have you, would address the economic feasibility of getting a COVID-19 testing program started. So that helps you understand how those things might link up here. Step 2 in program planning, which nobody's going to do here, I don't think, is a needs assessment. But if you're thinking about proposing a new program that hasn't been done in your community before, it might be important for you to do a needs assessment. And so I did go ahead and include this information about needs assessments, just in case one of you found yourself in the position of feeling like you did need to run a needs assessment before you got going, rolling out a new program in your community. And so this information, I'm not going to go through it all just in the interest of time, but you can circle back to this if you want. Similarly, crafting a mission statement is really important. And sometimes we use these just to draw the attention of our colleagues or a potential funder mission statements should be short. Again, this is for the program planning, which isn't going to apply to all of you. But this really helps narrow your focus and grab your listeners' interest. And so one mission statement that I like to give as an example here is from a program I worked on diarrheal disease in Nepal. And it just shows how it grabs your listeners' interest by giving a couple of key details that are a little bit beyond, like, we want to eliminate diarrheal disease, which sounds like improbable and implausible and therefore silly, to we would like to, our program is designed to reduce diarrheal disease in Ward 1 of the village from 80% of household members afflicted with diarrhea at least once monthly to 20%. So it like kind of grabs people and makes them think, oh, like, I get it. It's a diarrheal disease program. They know a little bit about the incidents already. They got a plan to reduce it. And it's really specific. She's talking about a specific ward within a village, et cetera. So for those of you who are going to be spending some time on the program planning phase, having a mission statement is critical. Okay, 4 and 5 is identifying stakeholders and understanding their perspectives, which is the third piece that you're going to be working on tomorrow in your at-home exercises. And so I listed some examples of stakeholders that I would imagine could play a role in the work that you do. State, tribal, county, local governments, educational institutions, maybe health ed centers or local health advocacy groups or fitness centers, whatever. You know, you guys know your communities better than I do. Maybe it's you want to engage pharmacists. I grew up in a very rural town of 800 people. And I didn't grow up with, you know, like, we didn't go to the doctor unless you had a compound fracture kind of thing, or you're unconscious. So like, the person that I would typically consult for health needs would be the, you know, especially as a young person, teen, especially asking something that I needed to ask on the quiet, or we talk to the pharmacist. I wouldn't have the money or wherewithal to go to the doctor by myself, especially as a minor, but I sure could approach the pharmacist. So engaging pharmacists in health outreach efforts, including with substance use, can be extremely effective. So these partners can be advisory. They can champion specific areas for you. They offer expertise and insight. They can help you share information or demonstrate your transparency to the community. They can participate in establishing your action plan or your plan for implementing and evaluating programs and ensure cultural relevance. It's important that all of the stakeholders that you hope to engage, that they agree with and understand the roles that you have thought up for them and that you're all moving forward on the same page. So there's no sort of, you know, unpleasant moments where you feel like you got let down or they feel like they got expected to do something they never expected to do. So just having sort of, you know, some transparency there from the beginning is critical. And then attending community meetings and forums or receptions, events, you all know this from the work that you're already engaged in, is critical for sharing information out. So this can also play into your dissemination plan at the end. It's really important to think through what the stakeholder analysis components would be. So when I think about my stakeholders, I try and think about whether or not they have a competing agenda to my agenda. Maybe they're funded by a different program that wants to do things a different way. And, you know, maybe they're already actively engaged with, say, for instance, integrated behavioral health. There are some, you know, organizations that feel quite territorial about using integrated behavioral health in our state. And so there can be some surprising sort of areas of tension with potential stakeholders because they're already working for somebody else and they have already carved out an area that they want to claim as like that's their area, and they don't really want you coming in and working on their area. So I don't like to be conflict oriented, but I like to be savvy when I'm thinking about potential stakeholders and really understand, like, how can I make them participating to help my project benefit them or advance their agenda? And in that way, it becomes a lot easier to engage stakeholders. Types of stakeholders include users, in other words, people who will use the products of the project, governance, like regulators, health and safety people, etc. Influencers, which in communities can include people like pastors or what have you, people who work in news outlets, on the radio, and so forth. And then providers who are already working in the field as a clinician, typically for substance use. So thinking about the stakeholders can be really important, because if you don't do it, then you can inadvertently offend people or make people feel like you've blundered your way in naively to something where they're already trying to do work, or they can be amazing and really advance your program. So a stakeholder is any individual, group, or organization in the community with an interest in the outcome of a program or project. And so your analysis, what you're going to do in your exercise, is to think about their needs and interests. Who should be encouraged to participate in different phases or stages, potential risks that could put the program itself at risk from some of these stakeholders. Like I said before, some territoriality can creep in, or what have you, whatever. And then also what opportunities they present. Okay, so any questions so far? None. Okay, I'll keep going because I see it's already 11:30. Okay, step 6 is the SWOT analysis. This refers to strengths, weaknesses, opportunities, and threats. This is a really commonly used way of thinking about both program planning and the evaluation component of programs. And this is just a kind of a mini framework within the framework to help you describe different parts of a program that are working or not working, or have introduced some weaknesses, and so forth. So as you, there's no step that you're going to be working on in your exercises that's specific to a SWOT analysis, but I left it in here as one of the 10 critical steps of program planning and evaluation, just because I thought you might want to refer back to it, or maybe introduce it in some of the language that you use to describe some of the details that you're going to be including in what you upload for the group to think about the mock evaluation that you design. So the purpose of the SWOT analysis is to assess the performance and capacity of the different units or divisions of the program. And ideally, each participating unit or each program component would undergo a SWOT analysis. And it's just a really effective tool at getting across some of the details on how a program is working. So here's a hypothetical SWOT analysis that I put together that is specific to this COVID-19 example. So like, for instance, I said, you know, for this SWOT analysis of the organizations that might be involved in doing COVID-19 testing, I included strengths that would be coming from these entities, the Montana University System, non-government organizations, and then these others. Weaknesses were immediately apparent in the COVID-19 testing, and those had to do with coordinating between all these different groups, and also messaging. As you guys will remember, messaging around COVID-19 testing was very discoordinated and confusing for a lot of people. There were, however, some opportunities to link to businesses that were developing labs and things like that, where we could do testing locally, not have to send stuff out. But then there were some real threats, and those were, like you can see at the bottom here, there were economic, like we just didn't have the resources, supply chain disruptions, like we didn't have the media to do the PCR testing in a lot of places. And then there was some misinformation from media or some other sources, et cetera. So this is a kind of SWOT analysis that you might want to think about if you're piecing together in your mock evaluation how a program is doing. And if it's not doing super well, a SWOT analysis can help you identify the places that the breakdown is occurring in. So step 7 is the really kind of crucial central piece, and this is the theory of change or the logic model or problem tree. So it's to identify the major problems in the community that you're supposedly working in, and what those problems causal relationships are. So a theory of change is basically, what is your idea about how a project is going to cause a change? So a theory of change, there's no specific theory. There are infinite theories of change. They're specific to the project that you're working on. So every project or program or intervention in the world has its own theory of change, which is just basically a set of sentences that describe the project, the need that's being addressed, and the project components, and how those project components are going to make a change that's going to be good in addressing the needs that were initially identified. So what we see in developing a logic model is that one of the outcomes is this thing called a problem tree. And so a problem tree is, again, like other things I've introduced to you today, read from the bottom. On the bottom are the causes, and on the top are the effects. And so the problem tree that's being addressed, or the problem tree that could have been developed for the COVID situation, was at the bottom. We're relating to testing. We had insufficient testing for our population size, combined with the fact that people didn't know that they were infectious with the virus. That led to a reality, which was that Montanans were unwittingly infecting one another with COVID-19. And then the ultimate effect, which was that Montanans were falling ill with COVID-19. So testing obviously was one pillar in the strategy that our state employed, well, like most states, to get around that. So the problem tree is one way of demonstrating what the logic model is of a program, identifying like, what are the needs, how are those needs related, and what's the outcome that's happening that we want to change. Another way of showing a logic model is just having a kind of a flow chart. And this is kind of a modified flow chart that I came up with as an evaluation tool for an integrated behavioral health proposed project. And you read it from left to right, top to bottom. So the funds that were being applied for were supposed to provide support for these 4 dot points. That was going to lead to these things, which was going to happen in the context of this stuff that was going on in the meanwhile, and also this other stuff, which would enable these changes in this thought bubble, which would lead to these outcomes over here. Now, in the slides that you can click on tomorrow, as you're thinking through your logic model for your evaluation, talk about this in more detail. And then the log frame matrix is the ultimate way of showing what the relationships are between the inputs, the outputs, the outcomes, and the goal. So you get from, like, if you wanted to, kind of skip through from the problem tree to this is a logic model, this is the theory of change in a single sort of slide. And then the log frame matrix takes the problem tree and the theory of change, and then it puts it all together with the inputs, the outputs, the outcomes, and the goal to show how the program, all the program pieces fit together to address a need by doing the following activities. And these activities are going to have these results, and those results are going to be measured in the following ways. So these 3 pieces, the problem tree, the logic model, and the matrix, are the linchpins of an evaluation framework. What I would love to see is that you upload your own example of the problem tree. Like, you can take my slide on this and take the words out, put your own words in. This one is a little bit harder. I just did this on a PowerPoint slide with the thought bubbles and the squares and stuff. You can draw this by hand, take a picture of it, and upload your drawing. That would be totally fine. or you can sketch it out on the computer. The log frame matrix, like I said before, you can just cut and paste into this slide. You can take the table out of the slide and put it into a Word document. And then this one here is populated with a whole bunch of language that helps us see what a hypothetical log frame matrix might look like for COVID-19 testing. So again, it's if-then statements. So the inputs are test kits, people's labor, travel. If those things are done, and the assumption is met that people come to the testing center, then the output is that COVID-19 tests are going to get run. And so you can see also that what we have here is that the inputs are test kits, labor, and travel. These are like the widgets. These are the things we put in at the beginning. The outputs are the things that result from those inputs. Outcomes come from outputs. In other words, the outputs are just tests run. That's great. You can run a whole bunch of tests, but that's not the end of the road, right? Because we need to know what those tests showed. What those tests showed is the outcome, and the outcome is to improve our knowledge of the spread of the virus. The outcome is not running tests. That's just a step on the path. Ultimately, the goal, the highest level impact, is that we're improving coverage of COVID-19 testing. And you can see in the next column over how we're going to establish each of these things. So these are the indicators, which are also referred to as the measures or the metrics. This is where it comes kind of down to brass tacks. The X number of COVID-19, 1.05 million COVID-19 tests were done at 56 sites. Very precise. Tests were run. What's the metric? What were the test results? X number of positives, X number of negatives. Improved our knowledge of the spread of the virus. Objectively verifiable indicator is now we can demonstrate, we can say the per capita incidence of disease. That's objective and it's verifiable, etc. So you can see how those parts fit together. The means of verification, it just tells you, this is just like, where'd you get your information? Oh, well, we got our information from the data collected at the test sites. They told us how many tests they did. We knew how many test sites there were. Okay, what about test results? We got that information from the data provided to us from the labs that ran the samples. Improving our knowledge by per capita incidence of disease. How do you know that? DPHHS collected that information on the number of positives and negatives. They modeled that against population size. That gave us this information, etc. So do you guys see how all those pieces of information fit together on this 16 cell matrix? Okay. Okay, objectives are the projects, is another way of saying like where you're going, what are the outcomes? So objectives and are sometimes modeled on an objective tree. So you convert the problem tree over into an objective tree, and this can also be a useful exercise. So an objective tree just converts the problem statements into positive statements. So like if the problem statement is no one knows what public health is, the objective statement is we will educate our partners about public health by doing X, Y, Z. So another step along the road of doing program planning and checking as an evaluator that good program planning occurred is seeing if objectives were stated and that they flowed right out of that problem tree. And objectives should be SMART. This is an acronym that we see a lot in the evaluation world, and it refers to the use of information that's specific. I've said that a lot today. It's measurable, it's achievable on the timeline, it's relevant to the problem at hand, and it's time bound. In other words, it is relevant to a specific point in time. And so what I've asked you to do when you're assessing each other's matrices in the workshop on the second at-home day is apply the SMART framework to the outcomes and measures or metrics that people chose, and just kind of cross-check for one another. Are your objectives SMART ones? So this here is an objective tree for COVID-19 testing. So you read it again from the bottom to the top. So you have COVID education, testing centers, and affordable testing that leads to COVID-infected individuals being identified and contact tracing being initiated, and then ultimately to the transmission of COVID being contained. So you can see, like, these are pretty simple statements. So I think a really important part of helping you understand what evaluation is helping you understand that a great thing to do is pick the low-hanging fruit for your first evaluation. You don't need to design an evaluation of your program for the first evaluation exercise that you do that is unnecessarily complicated. Pick a short time frame, pick relatively simple metrics that measure relatively simple behavior change, like I think Sean talked about wanting to do some movie nights. I'm assuming that the movie nights are to achieve a certain objective, identify what that objective is, measure how many movie nights were done, measure how many people came to them, and create an opportunity to talk to people about what happened during the movie night. I mean, surely the movies are being shown for a specific purpose. Maybe it's to build community. Okay. Create an opportunity to ask a selection of people who came to the movie night some questions about whether or not they felt like this event created a sense of community for them, etc. So the objectives tree that you can see on the screen here is really simple, and so can your initial evaluations be. When you start out in evaluation, I think it's really effective to choose things that you can really do, you can really accomplish, and then you can work from there in increasingly complex, longer time frame, and statistically complex study designs. But certainly for the exercise that you're going to develop over the course of this week, and then moving forward into your first forays into evaluation, I would say keep it simple, start at a pretty low level, and then work your way up from there. Okay, so that's the objectives tree. The next slides have to do with evaluation history and context. And unfortunately, I don't have time to go through all of the points that are on those slides. So I'm going to skip over them, but I did want to talk about one thing in particular. Down here, can you guys see two pictures? One is of some people fishing, and another is of a beautiful couple on their wedding day. Well, this is an example of a difference between outputs and outcomes, okay? This is in Uganda, and in Uganda, they suffer very much from malaria. And so they do a lot of distribution of bed nets. And bed nets are supposed to be put over people's beds to protect them at night from mosquitoes that carry malaria. And so there was one program where the evaluation was simply of the outputs. In other words, the outputs in the case of this project were the number of bed nets distributed. So can you guys think of any reasons why that might be stopping short of a proper evaluation?
Because the nets might not be being used for their intended purposes.
Yes, exactly. In the case of the pictures at the bottom, the two most common uses of bed nets in Uganda are as wedding veils and fishing nets. And there are all kinds of reasons, most of which are very good reasons for that. But the people who ran this program walked away from it feeling like they'd done a really good job because they reached their objective, which was to distribute bed nets. But they did not move the dial one bit on reducing malaria in this population. And so I think it's really important for us as people in the evaluation world to be mindful of two things. One is that if you just stop at outputs and you don't take the evaluation a step further and make sure that you build in metrics that actually look at outcomes and you link those outcomes back to the theory of change, then you miss a really important opportunity. Now, if the theory of change was only about distributing bed nets, then sure, you're done. You did your evaluation and you established that X number of bed nets were distributed. But my guess is that the funders of that program had in mind that they were actually going to be reducing malaria, not just distributing bed nets or nets. The other thing to bear in mind is misattribution, which means that in another program that we looked at, they were working in a village where, unbeknownst to them, there was a different mosquito eradication program happening. So they were distributing bed nets while this other program was killing mosquitoes. Well, malaria, the incidence of malaria went way down in that community, which they thought was all about their bed nets. But they missed the reality that there were way fewer mosquitoes because they were treating all the standing water for this mosquito larva. So there was a dramatic reduction in the mosquito population. So both programs and funders understood themselves to be highly effective in reducing malaria, but they were kind of working not at cross purposes, but they didn't realize the independent effect or complementary effect that their programs were having. And so that kind of goes back, I think, to the stakeholder analysis and make sure that you have a really clear understanding of your community, who is doing what, and where sometimes agendas are competing, because those two organizations did not want their funders to think that all that reduction in malaria didn't have everything to do with them. And that's really common in community organizations that are unfortunately sometimes competing for results. So I have all these funny points on these slides relating to stories that are about monitoring and evaluation, which you can work your way through at your leisure if you're interested. But what I wanted to focus on for today is the distinction between monitoring and evaluation. Monitoring is really at the inputs and outputs level, whereas evaluation is a much broader level that takes us to the outcomes and the goals or impacts level. So we like to see then that there's always a combination of both monitoring and evaluation working together, where evaluation is a bit higher level, it's much more holistic, it looks all the way back to the beginning of the program planning and takes it forward all the way to the end. Ideally, program planners and evaluators are working together from day one, right out of the gate. They're already working together so that the program planners know that the evaluator is going to use these metrics. And in order to populate those metrics and make a difference based on them, the program planner is going to have the following pieces in place. Do you know what I'm saying? So those two sides of the equation have to work together. So I just have some slides here that kind of distinguish between monitoring and evaluation. So monitoring is the periodic collection and review on program implementation. You have to modify it as you go because circumstances change. Monitoring helps us identify shortcomings before it's too late, etc. Whereas evaluation is a more systematic process that determines the extent to which service needs and results have been or are being achieved and analyze the reasons for any discrepancy. And again, we look at relevance, efficiency, and effectiveness, and if the program's inputs and services are improving the quality of people's lives. Again, moving us from the inputs and outputs levels right up that log frame to the top. And the thing that why so many people use the logical framework approach is because it includes all of these pieces. Other more elementary evaluation or monitoring frameworks are they limit themselves just to inputs and outputs, which doesn't really get you to where you need to be. So that's why I love LogFrame. Okay, so at the end of the slides here, you can see that I've included some information on the bits and pieces that you might want to include in developing your evaluation framework. And so in addition to inputs, outputs, outcomes, and impact, that would be those things that are bulleted on the left here. So what are the evaluation itself? What are the evaluation's own goals and objectives? What are the evaluation questions and sub-questions? What's the appropriate evaluation design? And then measurement, indicators, schedule, and budget. Most of us in evaluation specialists, if we're doing in-house evaluation, budgetary considerations aren't really at the forefront because it's just part of our job. But those other questions are going to be important for you to think through as you're working the exercises on Tuesday, Wednesday this week. So in the link that I provided for Wednesday, you can see there that there's some additional reading that you can do on the evaluation design. And for most people in this group, I think you're probably going to be focusing on a descriptive study. I don't think you're going to be in the either two buckets, including experimental or quasi-experimental. Those tend to be much more complex and frankly expensive, both in time and effort, evaluation study designs. I think you're going to be in descriptive. Maybe you're going to be doing a pre-post where you're collecting some information from people before your initiative or your intervention, and you're collecting information from them after the intervention has finished, et cetera. So you'll see in that document some ideas that will help you think through those evaluation design questions. Okay, so I returned to SMART metrics after describing the different kinds of outcome measures that you could potentially use here. So those are still important. And in this step 9, choosing indicators, before we finish today, I just want to spend a little bit of time describing this to you. Okay, so what I wanted to end on is talking about indicators. So I wanted to bring you back to the matrix that I had shown you before, and focus in on the indicators column, which is the second one from the left. And so these demonstrate the extent to which the results have been achieved, and how the achievement of a specific objective is verified or understood. And these are really the foundation of the M&E. So when you're working your exercises, you're probably going to end up spending a lot of time thinking about your indicators and making sure that they're the appropriate indicators for the behavior change or whatever it is that you are expecting to have an impact on, and making sure that the metric actually is measuring the thing that you want it to be measuring. And then I'm just gonna pause for questions here and make sure that there is nothing I've left unsaid on metrics for right now. I realize that it probably feels a little bit hypothetical until you start working your way through the steps 1 through 6, Tuesday, Wednesday this week. But is anything coming to mind right now that I could help answer? No. Okay. All right. So in that case, I'm going to scroll down here. I have some slides that you can look at your leisure about displaying information visually and how to do that effectively. But I just want to end on dissemination And can you guys see my slide? Because my monitors are very funky right now and are switching back and forth somehow. So the last exercise of the 6 that you're going to be working on, the last 2 are about drawing conclusions and then disseminating information to an audience. What I've suggested here is that the most important audience is going to be your original stakeholder groups. That includes your clients, but also other people in the community who have a vested interest in the program and its outcomes. So when you're disseminating your conclusions, not only are you including information on your findings, not only are you disseminating information on the metrics and what they showed about, you've moved the dial from here to here on a particular behavior or what have you, but you also want to go back and remind them, what was the need in the first place that this program was addressing? What were the program's goals? And what were the actions or the action steps that were taken? So basically, we're talking about the inputs and the outputs and how those address the needs. Then you layer on top of that the findings that were demonstrated by the metrics or outcomes or indicators that you use. Those are all, 3 words for the same thing: metrics, indicators, or outcomes. Then the last thing that you want to be talking about in disseminating information is any additional questions or concerns that people either bring up to you if you're describing results in person to them, or that you're anticipating questions that they might have, and you include answers to those questions that you anticipate in the document that you're preparing. So for instance, you might imagine somebody would make a suggestion X. So then you can either say in person, we could try that going forward and see if it helps, or we did try that, here's what we found, or we didn't have time, money, experience to do that, but we can explore it for the future. So when I write up these documents or prepare to present results in person, like at a conference or something, I always try and predict what people's questions or concerns are going to be. Usually those go back to assumptions that I've made and hopefully don't include any bad assumptions or people kind of saying, well, I'm surprised that you didn't think of XYZ. So I try really hard to think through what questions people might have, address those in the document, or be ready to address them in person if people bring stuff up. And then, so additionally, to the stakeholders, I really want you guys to think about your contributions that you as prevention specialists can make to the broader community. So maybe there's a newsletter that you would want to share your results with. Maybe there are summaries that would be appropriate for other people than the immediate stakeholders, future funders, healthcare providers, other patients that weren't immediate, or clients that weren't immediately impacted by the intervention or the program. But then even beyond that, maybe trade associations, conferences, or publications. Consider presenting at Montana Public Health Association's yearly conference, which happens in September. So those proposals are usually due in May. So maybe you could shoot for submitting a proposal next May if you design and do an evaluation as a result of going through this training. Or you could even write stuff up in a scholarly journal article or in the popular press, in the newspaper, or what have you. So I think as public health practitioners, especially those of us working in evaluation, in addition to our other duties, that dissemination of information is absolutely critical. Because if we just hold all that information inside, it really sort of defeats the purpose of changing health outcomes for the better. And I also wanted to say that, the faculty over here in our School of Public Health are always looking to people exactly like you. I mean, you have your finger on the pulse. And if you are interested in doing a scholarly journal article, you should never hesitate to reach out to one of the members of our faculty, because we're always looking for opportunities to connect with the communities in our state and with people, professionals like yourselves, who are, you guys have the street cred. You're the ones doing the work on the ground. you know your communities, any publications that we would ever generate would be infinitely improved by contributions from people who are in positions like you guys are in. So when you think about doing an evaluation, I really wanted to encourage you to think about doing it not just for more money or, you know, just to report back on, you know, to the community on what you're doing or your stakeholders, but also to think more broadly, because there is definitely a broader audience for how your program or your intervention or some existing evidence-based intervention applied in your community ended up working. Okay, so I'm going to end there. I had so much information to cover and I really zipped through the end there. So I would really encourage you guys to go back over the slides. Like I said before, they're linked in the Moodle in case there were sections that you wanted to go into more detail on or slides that I skipped over, because there is more information there that I didn't have time to get to, unfortunately. But eventually we're going to need you to do an evaluation of the class, but I don't think today is the best day to do that. I think we'll wait till the end. So after we gather on Thursday morning, we're going to be troubleshooting any problems that happened along the way and discussing how your evaluation scheme came together, your mock evaluation came together, feedback that you received using the workshop tool from each other, and so forth. So I'm going to see you online for sure tomorrow and the next day. And I'll see you on Zoom on Thursday. And expect information from me or Nicole or Emily later today about how to log into the Moodle. And then I was thinking also that I might just make sure that you all have my email.
So I'll be sending out an email that has the link, your user login information, Kimber's contact information, and the video and agenda from today. So all of that will go out momentarily.
Oh, good, because I was going to put my email in the chat box, but my Zoom is really misbehaving. Oh, maybe it's because I'm sharing still. Oh, here's the chat box. Oh yeah, I'll just pop it in here really quick. Oops, at UMontana. So kimber.mckay@umontana. If you guys want to be in touch in the immediate interim in between now and when we get the login information. Oh, did you get it from Shay already, Emily?
Yes.
Oh, super. Okay, good. So we will be in touch with you very shortly with logging into Moodle, and then I'll just be kind of hanging out in Moodle for most of the day. And you guys can ping me using that platform through the discussions or using my email.
Cool.
Yeah, we're past 12. Thank you so much for staying late. And any questions or anything that I can address right now, or should we just talk on Moodle?
We can talk on Moodle, and if anybody has any questions about anything that might be program related or idea related, you can feel free to email me, ask me a question, since I'm probably more familiar with them. So please email away. Doesn't matter if I'm your TA or not.
Thank you so much,
Excellent.
everyone.
Thanks.